In this video, we are going to talk about what you can expect when you have an L1 to L5 spinal cord injury. The learning objectives are listed above. We will talk about activities that you may need assistance with, as well as different pieces of equipment that might be helpful to you, and then also give you a general understanding of your level of function with an L1 to L5 injury. Some things that you will be able to do include being able to move your arms and hands normally. You will have the ability to speak, breathe, and chew independently. You will also have the ability to drive a car with specialized features for you. We'll talk about how you can use a manual wheelchair to be mobile in your home and in the community. And you even might be able to use specialized braces or assistive devices to walk short distances. With your injury being in the lumbar region, there's also potential that you maintain bowel and bladder control. What you can expect to be different is that you will not have full sensation or movement of your legs. Once you leave the hospital, you may require the use of adaptive equipment to help with bathing, grooming, dressing, and you might need assistance with standing, either within a standing frame or with braces. Pictured above is what I just mentioned, called the standing frame. It is originally in a seated position where the person would sit down and then have those pads blocking the knees to help provide some outside support and support the legs in the standing position. And then the chair would slowly be raised up into that standing position where there's a tray table at the top so that the person can bear weight through their arms, do different daily activities at that table. And this is a great device to use to get your body used to standing and to get your leg muscles moving. Another piece of equipment you might use at home is pictured here, called the slide board. This is used to transfer from one location to another. So for example, if you're sitting in a wheelchair and you'd like to get over to the bed, then you would put this slide board underneath of your thigh and hip, and you would scoot along the board until you're all the way over to the bed. The board would remain underneath of you, and then you would remove it once you're sitting in the bed. This is what we call a 3-in-1 commode. So this can go next to your bed for ease of use. You would just place this blue bucket and slide it up under the hole created here by the chair so that the person can use the bathroom, and then when they're finished, you can dump whatever's in the bucket. Or you could also place this commode over top of a toilet you already have in your bathroom. That way it makes the height of the toilet taller and it would make it easier to stand up from. It also has the additional supports of having handrails on the side, so if you have weaker core strength, it also helps with that as well. Another option for adaptive equipment in your bathroom is an elevated toilet seat. This also just makes the height of that toilet taller, so it's easier to stand from, and this specific one here has rails on each side. We might also recommend that you install grab bars shown on the wall here in your bathroom. They can be next to the toilet, in the shower. It just gives you something else that you know is sturdy that you can hold on to when you're going into a standing position or transferring from place to place. You can expect to be working with several different kinds of therapy. With occupational therapy, some goals that you might work towards could include making sure you have frequent and proper pressure relief so that we're preventing pressure sores and protecting your skin. We'll help develop a bowel and bladder management schedule. We can work towards independence with you completing self-care tasks. We'll also try to achieve independence with bed mobility, rolling side to side, as well as transfers to and from different locations. We'll educate you and work with you on manual wheelchair mobility. This can look like having you navigate small curves, uneven surfaces, give you some different challenges in the space around you so that you know how to maneuver. With that, we'll also practice what you do in the event of a fall, either how you would get yourself up from that or who you can call in those situations. We'll also work towards a standing and walking program. You'll definitely be working with a physical therapist through this process as well, using either leg braces or some kind of assistive device. And with that, that wraps up the information we believe you should know when you have an L1 to L5 spinal cord injury.